Administering medication by IV Piggyback. First, I'm checking the doctor's order and the patient's chart and comparing it to the MAR. And I see that doctor has ordered for patient John Smith 250 milligrams of Flagyl in 50 milliliters of 0.9% normal saline, Q8H, to be infused over 30 minutes. That's the first check. And getting and preparing the medication and checking to make sure that the Piggyback IV is correct. It's the 50 ml, 0.9% of normal saline, and the second line is 10 drops per milliliter, and both are intact and not punctured and not expired. So then I'm going to calculate the correct dose, which is 27 drips per minute, or 7 drips per 15 seconds. And then I'm going to look in the drug book for compatibility, and I see that Flagyl is compatible with 0.9% normal saline. So then I'm going to check the patient's ID badge in the patient's room and ask name and date of birth and allergy. And so that's check 2. And then assess the patient. And then I'm going to do check 3, which is comparing the medication and the doctor's order and the MAR, and going through the 6 rights, which is the right patient, right medication, right dose, right time, right route, the IV Piggyback, and we'll document in the MAR and the INO record after giving the medication. Then the next thing I'm going to do is we will open and remove the caps. And this is after I had done hand hygiene. And sterilely spiking. Okay, and then we have to remove the primary, put the primary bag to the lower position for gravity. Okay, and then I'm just going to let a little bit out, and after squeezing to half full and opening the clamp, and it is this is primed. The tubing is primed. Then I take an alcohol wipe to the hub, the wide port that is the closest to the primary saline bag, and I scrub the hub, and then I'm going to lower lock it. Okay, and I've got my second hand watch, and I'm going to get 7 drops per 15 seconds. So I'm going to completely open the top clamp, and then I'm going to slowly open the bottom clamp. Okay, and that looks a little fast. Maybe not. Okay, and then I'm going to time it. Yep, it's too fast, so I gotta lock it down a little. And that looks good. Okay, so since this is demonstration purposes, I'm going to go ahead and close this. Okay, and of course, I will be watching the patient for any adverse reactions. And once the medication has gone through, I will regulate the flow rate back to the original, which was 8 drops per 15 seconds, which comes out to 125 milliliters per hour. And I've observed for adverse reactions, and I've documented into the MAR and the INO report that I have given Flagyl 250 milligrams and in 50 mLs of 0.9% normal saline, and that was 27 drips per minute. So then the next medication I'm going to give is an IV push for Benadryl. And so I'm looking at the doctor's order and the MAR, and I can see that doctor has ordered a one-time dose of 25 milligrams of Benadryl IV push, and it comes stock as a 50 ml or 50 milligrams 2 ml. So calculating, I will be giving 1 ml. And so looking at the MAR and the medication, and I prepare the vial in the appropriate way and comparing it to the MAR. And so that's check 1. And then I'm going to also look in the drug book to look at the compatibility of Benadryl with 0.9% normal saline, and they are compatible. And also the dose rate in the drug book is 1 milliliter per minute, so I will be administering it slowly. So then in the patient's room, I will check the ID bracelet and ask name and date of birth and allergy, and so that's check 2. And then I will assess the patient and go through the 6 rights for the third check. So it's the right patient, John Smith, and the right medication being the Benadryl, one time only of the 25 milligrams in 1 ml. So it's the right dose and the right time, and the route is IV push, and I will document in the MAR and the INO report after giving the medication. If it was not compatible, 2 options. The first is to catheter a different location to administer the medication, but if that's not an option per hospital protocol or doctor order, I would do either 10 or 20 milliliters of saline, followed by the medication, followed by the saline, and I would use a different alcohol wipe on the hub closest to the site of entry for the saline and the Benadryl, and then the saline again. But since this is compatible, it's okay to go ahead and give the IV push. The way to know if the site is patent is to add push a small amount of saline, and making sure there's no clot blockage resistance to go in. Another thing to be concerned about is phlebitis, so I would look for looking at the character of the port of entry, making sure there's no redness, no swelling, no pain, and any other types of symptoms that would make it not a good idea to give medication in that site. Another way to also know that it's patent is if the patient does feel the medication going in into the vein as well when you inject. So then what I will do in this case is I will take an alcohol swab, and I will scrub the hub of the Y port that is closest to the site of entry. It's further away, the furthest point away from the bag for the existing line. And I will, to inject, I will clamp above the site, which is, it's a word with an A. I can't think of it at the moment, but I will be injecting slowly 1 ml per minute into the site after clamping. It's antegrade as the word, and then afterwards I will observe for adverse reactions, and then when I pull it's either going to be a needle or a needleless injection, but then I would pull it out, and then I would return the flow rate to the correct flow that it was previously, which was 125 milliliters an hour, or the 8 drips per 15 seconds. Thank you.